Most people assume that braces and Invisalign would be a logical first step for curing your child's crooked teeth. But do braces really cure the hidden health issues that are associated with crooked teeth? Allow me to reveal the true reason on why teeth grow crooked in the first place, and how it's linked to deeper health problems that even most orthodontists overlook. Here's the real problem. Teeth grow crooked because of stunted growth and development of the upper and lower jaw bones. Basically, the mouth is too small, which causes a second problem. When the mouth is too small, it pushes the tongue to the back of the throat. As you might suspect, this can lead to restricted airflow, which ultimately leads to lower oxygen levels. Unfortunately, Invisalign and braces fail to cure this silent problem. A problem which only gets worse as the child later becomes an adult. So, is there a way to cure crooked teeth while simultaneously fixing the problem that over 80% of Americans suffer? The short answer is yes. I recently had the pleasure of interviewing one of America's leading orthodontists on this innovative treatment approach, Dr. John Napolitano, over at Innovative Dental Professionals in Barrington, Illinois. For decades, Dr. Napolitano has been crafting beautiful smiles, but more importantly, he's been helping his patients achieve whole body wellness.
All airway obstruction, where the base of the tongue infringes on the trachea, that type of airway obstruction, 100% of those obstructions are caused by an oral condition. The tongue does not infringe on the trachea if it's allowed to be in the place it was designed to be. And the tongue was designed to be in a mouth that's normal in size and shape. If there's any trauma to the lower jaw that prevents it from growing to its full position, if the chin looks like an Adam's apple instead of a nice square lower jaw, and it's because of some trauma, the tongue is connected to the lower jaw. And if the jaw hasn't grown forward, the tongue hasn't moved forward, it's back in your throat. So that's one symptom. If you look at somebody's soft tissue profile and their upper front teeth are here and their lower front teeth are here because the lower jaw hasn't grown forward, that is an airway obstruction. And it's going to get worse as the body gets larger, because oxygen demand increases as the body increases in size. The only reason why a child cannot breathe through their nose is because when they close their mouth is so small that they can't keep their tongue from blocking their airway. So they open their mouth up so they can take and move their tongue upward and forward out of their throat so they can breathe through their trachea. When they close their mouth, they gag on the back of their tongue. So they hang their mouth open and they breathe through their mouth. And that's why they don't breathe through their nose. There's nothing physically wrong with their nose. There's nothing physically wrong with their nasal pharynx. The problem is the mouth. The mouth is too small. The upper jaw, the maxilla, too small. The lower jaw, the mandible, too small. Dark patches under the eyes are usually a sign of oxygen deprivation. Middle ear infections, come from children who can't breathe through their nose. If the ENT can't straighten it out, go see a growth and development orthodontist. A child that just doesn't want to run, doesn't want to go out and play, would rather sit on a couch all day. Find out why. Bedwetting, airway problem. Correct the airway, bedwetting goes away. ADD, ADHD. If your child is diagnosed with that, you need to see a doctor like Dr. Sheldon or any of his associates and get them to diagnose that as sleep apnea in children, and then go see an airway orthodontist, or more specifically, a growth and development orthodontist. So just above the soft palate are a set of lymph glands called adenoids. So adenoids are sitting in the nasal pharynx, and they take up a little room, but because the adenoids are above the soft palate, they really don't constrict the tongue that much. But when you're starving for space, taking the adenoids out is not a bad thing. It helps. And the other lymphatic tissue that we all recognize is tonsillar tissue. And the tonsils, if this is a soft palate, the adenoids are up here, the tonsils are on either side of the oral pharynx, on either side of the tongue, the base of the tongue. They take the tonsils out. So that gives the oral pharynx more room, and it puts more room in the nasal pharynx. But it still doesn't correct the size and shape of the jawbones. The jawbones are still too small. But it does correct things. If you do a tonsillectomy and an adenoidectomy on an 8-year-old, they can breathe through their nose. So it's a valid treatment. But all of a sudden, that child turns into an 18-year-old or a 25-year-old, and they end up with sleep apnea. The tongue is blocking the trachea again. Well, it's not because the tonsils grew back. It's not because the adenoids grew back. It's not because the tongue got bigger. It's because the patient got bigger. When they were 8 years old, they could get away with this much oxygen per inspiration because they were little guys. They had small muscles. They were only 2 feet tall. At 25, the young people nowadays are 5'10" and bigger. And they have muscle on top of muscle on top of muscle. Every time they breathe in, they have to breathe in this much air. So the airway that was satisfactory at 8 is not satisfactory at 25. And that's why we see CPAP machines all over the place. And it was studying with Dr. Moss and proving the point beyond a shadow of a doubt that bone is Play-Doh in the hands of muscle tissue that led me to looking at crooked teeth as not a sign that you have too many teeth, not a sign that the teeth are too big, but a sign that the bone has not reacted to the degree that it should and is not the size and shape that it should be. And that was my quest then, was to become an orthodontist that could help people whose bones did not grow normally to the point where the bones were normal in size and shape. And that's why I've never extracted a tooth for orthodontic reasons.